I bet you all know reading articles and don't understand the statistics inside this article. Well, that's a topic that we get you covered. So watch this video and learn more about statistics in dental literature, how to read it, how to understand it better. So let's start.
In the indispensable role of statistics in dental research, statistics serve as the backbone of empirical research, guiding dental professionals in deciphering complex data to make evidence-based decisions. In the realm of dental research, statistics provide the tools to evaluate the effectiveness of treatments, understand disease prevalence, and develop preventative strategies. Without this foundation, dental research would rely on anecdotal evidence and subjective interpretations, significantly limiting advancements in the field. The application of statistics in dental research not only enhances the credibility of findings, but also underpins the development of new techniques and materials. For instance, statistical analysis allows researchers to ascertain the success rate of different dental implants over time, thereby influencing clinical practices worldwide. This quantitative approach ensures that conclusions drawn are not only based on observable outcomes, but are statistically significant, offering a higher degree of reliability. However, the impact of statistics extends beyond just validating results. It also plays a crucial role in determining research funding and policymaking. Accurate statistical analysis can lead to more effective allocation of resources, prioritizing areas that show statistically significant needs or benefits. This is particularly crucial in public health dentistry, where resources must be strategically deployed to address widespread dental health issues. Furthermore, statistical literacy enables dental researchers to critically evaluate studies in their field, fostering a community that continually improves through rigorous scientific scrutiny. By understanding the nuances of statistical methods, researchers can better design studies, analyze data, and interpret results, which in turn contributes to the overall advancement of dental science. In common missteps, statistical errors in dental studies, statistical errors in dental research can range from simple miscalculations to complex misunderstandings of data analysis techniques. Common issues include the misuse of statistical tests, overreliance on p-values without considering effect sizes, and the neglect of confounding variables that could bias results. These errors not only distort the findings of individual studies, but can mislead clinical practices, potentially compromising patient care. For instance, the inappropriate use of correlation coefficients can lead to incorrect assumptions about causality between variables, such as fluoride levels and tooth decay rates. Misinterpretations like this could drive flawed public health policies or clinical recommendations. Similarly, failure to adjust for multiple comparisons in large datasets might lead to false positives, suggesting relationships or effects that do not actually exist. Another frequent mistake is the underestimation of sample size needed to achieve meaningful results. Underpowered studies can fail to detect significant effects, leading researchers to conclude that a treatment is ineffective when, in reality, a larger sample might have proven otherwise. This not only wastes resources, but also stymies the development of potentially beneficial treatments. Addressing these statistical missteps requires a concerted effort to foster better statistical understanding and application. Journals and peer reviewers play a critical role in this, rigorously checking for statistical validity and encouraging the use of advanced statistical techniques that can handle the complexities of dental data. In a comparative analysis, dental versus medical research statistics, while both dental and medical research rely on statistical analysis to validate findings and guide clinical decisions, the approaches and challenges can vary significantly between the two fields. Medical research often deals with larger sample sizes and more diverse study designs, which can facilitate more robust statistical analysis but also introduce greater complexity. In contrast, dental research sometimes struggles with smaller sample sizes due to more localized treatment areas and patient availability. Despite these differences, the fundamental statistical errors observed in dental research, such as p-value misinterpretation and inadequate power calculations, are similarly prevalent in medical studies. This suggests a broader issue in the scientific community's approach to statistical education and application. However, medical journals typically have stricter statistical review processes, which can serve as a model for dental research publications to emulate. Moreover, the stakes in medical research can amplify the consequences of statistical errors. Misinterpreting data in medical trials could lead to incorrect treatment recommendations on a large scale, potentially affecting millions. Dental research, while usually having more localized impact, still holds significant public health implications, particularly in areas like epidemiology and preventive care. Learning from the rigorous statistical methodologies employed in medical research could greatly benefit dental researchers. Adopting practices such as detailed protocol registration and increased transparency in data handling can enhance the reliability and credibility of dental studies, aligning them more closely with their medical counterparts. Section 4. Case Studies: The Consequences of Statistical Misconduct. Statistical misconduct in dental research, while not as frequently spotlighted as in some other sciences, can have profound impacts on both the scientific community and public trust. Cases where data is fabricated, manipulated, or misreported not only tarnish the reputation of individual researchers, but can lead to significant setbacks in dental knowledge and practice. For example, a prominent case involved a researcher who published studies with fabricated data on dental material durability, which subsequently influenced numerous other research projects and clinical decisions. These instances of misconduct highlight the need for rigorous data verification processes and ethical standards within the research community. The repercussions of such unethical practices extend beyond academic circles. They can result in wasted resources, misguided clinical practices, and even harm to patients who receive treatments based on flawed research. This underscores the importance of statistical integrity and the responsibility researchers hold in ensuring their work is both accurate and ethical. Moreover, retractions of published papers due to statistical misconduct can lead to a cascading effect, where multiple subsequent studies built on the retracted work might also be called into question. This not only disrupts the research landscape, but also erodes public confidence in scientific findings. To mitigate these risks, it is crucial for peer reviewers and journal editors to be proficient in statistical methods, enabling them to identify potential red flags before publication. Educational initiatives aimed at enhancing statistical literacy can serve as a preventive measure against misconduct. By fostering a deeper understanding of statistical principles among researchers, the likelihood of both inadvertent errors and intentional manipulation decreases. These educational efforts should be supported by ongoing professional development opportunities that keep dental researchers abreast of the latest statistical techniques and ethical guidelines. Section 5. The imperative for enhanced statistical literacy in dentistry. Improving statistical literacy among dental professionals is not just a matter of academic integrity, it's a practical necessity for advancing the field. Enhanced understanding of statistics enables dentists and researchers to critically assess literature, design robust studies, and apply findings appropriately in clinical settings. This shift towards greater statistical competence must begin at the educational level, incorporating more comprehensive statistics, training in dental schools, and continuing education programs. Statistical literacy equips dental professionals with the tools to question and validate the research they rely on for clinical decision-making. For instance, a dentist who understands the nuances of statistical analysis is better positioned to evaluate the efficacy of a new treatment for periodontal disease, or to challenge the findings of a study that does not adequately control for confounding variables. This critical approach not only improves individual practice, but also elevates the standard of care provided to patients. Additionally, as dental research increasingly intersects with other fields such as genetics and biomaterials, the demands on statistical knowledge grow more complex. Understanding advanced statistical models and multivariate analysis becomes crucial in accurately interpreting the interactions between multiple factors. This not only enhances the precision of research findings, but also allows for more innovative and interdisciplinary approaches to dental health challenges. Finally, promoting a culture of statistical curiosity and integrity can have a transformative impact on the dental field. By fostering an environment where questioning and verifying statistical claims is the norm, the dental community can achieve greater advancements in research and practice. This culture shift ensures that dental professionals are not merely passive recipients of information, but are active, informed participants in their field.